minutes here for everyone to get accepted and settled. Anticipate there'll be a few more that keep coming in here over the next 3 or 4 minutes. But we'll get started here momentarily. Hope everyone is holding up well in your areas of the world. And make sure everyone's lines are muted. So we do have everyone, just for those that have just entered the room, we do have everyone's cameras off and microphones mute, just so we use the least amount of bandwidth as possible, so we all get a nice clear conversation going here today. I think, good morning, Bob. Thank you for the comment. We can get started here, I guess. Some housekeeping rules for everyone. Please make sure that if you have any questions or would like to make any comments at any point in time, please just raise your hand. I'm going to mute a couple of lines there. We just want to make sure it's perfect for everyone. Okay. So housekeeping rules, please make sure that you stay with your microphones off and your cameras off to have the most optimal amount of bandwidth for the call. Any questions that come up during the call, please feel free to either text them in, or if you'll go to the participants section at the bottom of your screen, you'll see an area there where you can raise your hand. If you raise your hand, we can, at appropriate time, we will unmute your line for you and allow you to ask your question at that time. I think those are the majority of housekeeping rules that we'd like to kind of set for today's call. I think everybody has now entered the room. As more come in, or if you guys get kicked off, I'll be readmitting you into the room. And with that, let's get started. Well, thank you everyone for joining us here. I'm Daryl Simpson from Salient Metal in Canada. We are helping co-host this event with MediSpec, this one being more focused towards our aesthetic clients and our aesthetic treatment offerings available through MediSpec. We had a great session yesterday learning about lithotripsy and some ED solutions. And I'd like to introduce our speaker for today as well, Mr. Avner Spector, founder and CEO of MediSpec. The MediSpec is a maker of ESWL, lithotripsy, and low-intensity shockwave systems for cardiology, orthopedic, andrology, nephrology, and aesthetics. We will be focusing on the latter here today, and thank you. We have a visual of experience, and to introduce Mr. Avner, and would like to hear your thoughts. Thank you, sir.
Thank you very much, Daryl. I appreciate all your time and being available to hear about radial wave and aesthetic, and a little bit about MediSpec, and we'll go quickly to see what we have. So a little bit about MediSpec. We are from '92. We produce shockwave therapy. We produce as well the erectile dysfunction ED device, cardiology device, obviously the aesthetic that we'll more concentrate today, but also in orthopedic and physiotherapy and thermotherapy. So what is the radial wave, or what we are looking here? Basically what we do, taking medical technology to tell or wave therapy, and the device have the handpiece that's create the radial wave, as well as a control unit with the power supply that's give the full command to be able to give the treatment properly. Cellulite
muted there. Yeah.
Acoustic radial wave technology It's non-invasive, easy to operate, as well as no downtime effect, low cost from consumers. So obviously these kind of things give us a good return of investment, and that's a very good cellulite. It's not related to age, even so it's related to women, and that's we go a little bit later. But any woman above 18, if she do a lot of sport or all of them suffer from a cellulite, and it's can eliminate. It's the nature, and this is something that we need to try to take care for it. So if we look about what is cellulite, cellulite is a static aspect of the skin. It's do it like a dumpling and round. As usually people look about like a cottage or orange spring that we see not as straight at the outside, and usually we want to make it a little bit better. So when we look about it, cellulite treatment that exists today is a skin elastic improvement, body forming, circumstance reduce, deep tissue massage, all those effects we're getting, liposomic drainage and muscular tuning, and that's what we expect to get from this application whenever we go to the aesthetic and using the Slimspec. The benefit is a smoothing of the skin surface with a notable reducing of cellulite and increased formation and lift of the skin. And we will see after that a few cases about, and even reduce sizes by up to 5 centimeters and all those things, part of it. And we have a data collection, so the effect is also for 6 months after the treatment. Why Slimspec or why Radial? First of all, is a visible result. That's what we're looking for, the aesthetic. It's a painless, non-invasive treatment, no downtime after the treatment, and a good return of investment, easy to operate, and compliant with the device compliance with all the standards like FDA, CE, anyone like that. But now, what the Slimspec do to the skin and what we are doing. So basically, when we look, whenever we have a cellulite, before we have the aspect that we're getting a poison in the skin. And what we do with the radial wave, we stretch those aspects and bring more blood to this area, increase the lymph flow, and stretch the collagen. And whenever you do this aspect, that's what make it a straight and smooth skin, and that's also the part what is reduce the size and all those things. But if you want to go a little bit more deeper to understand this aspect, when we look on the cells of the woman, we have the collagen and we have the fat and we have oxidation and all of these related that's connecting here, and to make it smooth, it's important to have good blood circulation on the skin and to stretch the collagen, because each one of them that's not work properly, that's what creates the cellulite. So that's exactly the typical aspect to something that's working on the surface, very suitable to radial technology that's working on this part, that's help a lot, and that's the effect that we are getting. When we look about cellulite contribute factors, usually it's hormonal change, pregnancy and all those things, eating, habit, if you eat, drink a lot, lack of sport, and also having the wrong clothes. And usually that's beauty come before health. And this, if you go with the heel, it's not something good for this aspect. But it doesn't matter, even if you keep all of them, most of the women will have this level of another of cellulite. So when we look about it, what is the option that exists when we're talking about treating cellulite? Neoplastic massage, that's very helpful. Anti-cellulite cream, and one of the things that we are recommending during the time that you're using a Slimspec type of cream, then it's getting much better to the skin, and that's could help a lot, and you get two effects in the same treatment. Obviously, electrostimulation, endomology, radiofrequency, laser, ultrasonic, liposuction, cool scalping, all those things. There are a lot of type of therapies, but one of the simple one from them is obviously the radial wave technology. That it's very simple, and we can do it easily without thinking a lot what we are doing. Contraindication is usually we don't want to treat pregnancy a woman, especially if we're talking about the belly area. This sometimes say unfair, but we don't want to get inside. Any skin disease, anticoagulant therapy. I'm not talking on the level of aspirin, but if you take a very high level anticoagulant, it could be could make more damage. And a metabolic disorder also, like a strong diabetic and anything like that, could be a contraindication. And if we have for some reason inflammation in the area, we don't want to treat that condition. If you want to understand the mechanism of work, as you see it below, we have projectile inside the device that's move and touch the area here. And by touching the probe here, that's what making the radial wave getting inside to the tissue. And one of the reasons that we call it radial wave, see that they go in radial direction and obviously spreading to the side, and the pressure and the tension going is lower and lower as much as you're getting inside, like any type of radial way. For radial therapy, usually they have two techniques. One is the electromagnetic. This is what we been the first one, and other company follow us and even buy from us the right to the device. But again, if you want a little bit to go, what we have a unfocused wave, maximum energy, it's on the surface. The effect is mechanical effect, like a deeper tissue massage or stressing the tissue. This is the most effect. We can measure the pressure, but it's very low pressure, not more than 3 megapascal. Rise time is very low. Penetration depth is very low. You can't go too deeper. And if you look, it's go for a long term relative to a shock wave. And if somebody called to radial wave a shock wave, they done a big mistake. Even sometime they can give the same effect, and that's good. If we look
Muted.
First of all, we have a mechanical effect, that's improve the circulation and decrease fat cell in the abdomen. And then we have the effect of increasing blood flow by doing massage and some other effect. stimulation of fibroblast, and this is one of the most effective aspects, that the cellulite is the collagen. This is very important part, and by doing the radial wave, you make them more effective from this aspect. And the last one is some new revascularization, but it's more improved the vascularization in the area. When we're doing the protocol, we need all the time to remember that it's when we're using for a cellulite, it's not one place, and we want to do it usually according to the lymphatic movement of the lymphatic on the body. And if you see here the picture, we want to go in those direction to help to the lymphatics to go in each area that we do the treatment. So usually when we do a treatment, the direction that we move the hammer is going this direction. So first of all, we put a cream on the tip, on the applicator, and on the skin. And as I say, you can use a standard ultrasound gel, but I recommend to use any kind of a good cream, and especially cream for cellulite will get both effect at the same time. The applicator move along the skin, the lymphatic nodes direction, and we want to put approximately 4,000 shock during the treatment, and energy level usually between 2 to 3, and to do it twice a weekly or one weekly according to the convenience. Usually it's between 7 to 9 treatment, and we see according to the progress, and that's what give us the ability to go. Clinical case result, it's very important to see what we do in the formation and in the skin. So we have a very good picture that we have with ultrasound scanning to see the change of the skin and to see what we're getting. And we saw a view of how it's more smooth and uniform, and the epidermis, and this is a very good way to do. But also, usually we want to see what is outside, because the skin itself, it's not the right way. So we see a few cases here for 40 years lady, so we see all the effect here. We can see it also in the belly, as well as in the belly, and we can see it in the back, and we can see it also in the side, and can see it in the belly. Here you see two things stretching the tissue, the tissue, and also tightening the muscles and all those things. We can see it below the hand when we do it. We can see the effect. And even on the neck, we can make this treatment and to get a better effect. And on the face, so basically any place that we want to tighten the skin, and also to eliminate stretch marks, especially after delivery, it could help a lot. And spiral veins also, we can take care to treat them to disappear. So the potential, if we see it, we do a lot of things. So where we want to use this type of treatment, we want to do it in beauty salon, med spa, as well as the general practitioner. In any place like this, that will be the right way to do it. Another direction that's now is very important when we go to a post lipolysis or cryosculpting, anything that it's called in this direction. This is very important way to do, and the Slimspec have a very big effect to do. And a study that's done show very clearly the big difference of the result between the regular cold sculpting, vice versa, cold sculpting with radial wave therapy, and it's very important aspect. So obviously, first you mark the area where you want to do the treatment, and you do the cool scalping with any device that you have in your capacity. And after you do this, as you see, you push it and cool it in all those directions. Then you go and smooth the area with the Slimspec, and that's give a very, very good result. And this is a very important direction to look for it. See and how it worked for display. So basically, the Slimspec give you a professional system for cellulite body farming treatment setting and tone of cellulite control. So whatever we want, it's good, nice. And this product already win a few prizes regarding the efficacy, innovation, and all those directions in French in cosmetic exhibition. Radial wave technology, we won't go from the cosmetic aspect. If already it's also used for a physiotherapist, and this effect very nice exists, and you have a very good result in orthopedic application, especially with plantar fasciitis, tennis, and golf elbow, and shoulder classification, and all those things. And the radial wave effect is directly on the joint and on the tissue, and it's very, very effective. And if you're looking on the application that we can get it in plantar fasciitis, shoulder classification, bursitis, soft tissue, trigger point, joint tendons, lower back pain, deep tissue massage, any direction in this aspect that could be worked very nicely and could do the the first one with 177 patients with 90% success reduced. Also from Dr. Rob, 58 patients, and they have 86 improvement in the pain. So sample of treatment protocol. When we're doing the shoulder, we prefer to do it with low frequency, energy to 1 to 2, 2,000 shocks each time, and average session between 1 to 4, and the interval approximately more than 5 days between one session to the another. Part of it, it's important when you're talking about those physiotherapists or orthopedic application, the time in between giving curing time to the tissue and make better effect than to do it in early session one by one. If we go also with chronic shoulder tendonitis, this is a little bit different. So we go higher frequency, give more shock, and up to 12 treatment, still we keep the same different. If we go to plantar fasciitis, with or without heel spur, as we know, a lot of the cases they are without heel spurs. And also we can go to tennis and golf elbow and see from which direction you go to each one, and it's very simple and very convenient to do the treatment, shoulder calcification, and all those directions from what to come, trigger point. And what is important here when you do the treatment, you want to concentrate to put the treatment near the area that you feel that you see give the feedback from the patient, where is the maximum pain that you have, and that's where you go and do the treatment. Also, a joint like tendons and ligament, you can do it, and Achilles tendons and all those things, that's a very good treatment for those aspects. That's how you do it for lower back pain, and deep massage whatsoever. You can do it exactly in the same way and do it in better way. In this case, you maybe prefer to do it with a low frequency. The lowest frequency you can do. And you have also an option for burst. Sometimes it's very important for this, and also for a trigger point. A lot of time you will prepare to work with the burst mode. It's limited the number of shock that you give each time. Here we jump a little bit, maybe a small break to any question up to here on the radial wave before we'll go to erectile dysfunction.
Yeah, there's one from Kenya, Maggie. What is the efficacy for Slimspec cellulite treatments? How frequently should they be done after the initial 9 sessions?
It's depend between one patient to the another. Usually you will see the effect stay for 6 months, but it's go down slowly. So some women it will go faster, some women it will be up to 1 year. And usually because it's done via cosmetics and in any way the woman come. So this is part of when you do a treatment of quality of life. So also it's according to the feeling of the lady, what she wants and how she feel. So there is no actually clear time, but for example, they could do a few sessions, like a 4 session, and then they want to do it 1 in a month to get a treatment to maintain it forever. So the protocol is very flexible, and it's more according to the requirement of the. Any other question?
No, I did just note on the chat as well for everyone that there is a small issue on the computer there regarding the mute. We are aware of it, and it is being handled quite well by Avner during the presentation. So thank you for any notes. And is the protocol the same for spider veins and stretch marks as for cellulite?
Yes, they're approximately the same, yes.
Okay.
Yes.
Slimspec, yeah, you had mentioned 4,000 shots. What area does that treat?
Usually we do it like that, but when we go a little bit more deeper, the size of the applicator is something like nearly 7 square centimeter. So you can apply it according to the size, but if you do a really big area, if you stretch it in a very big area, then maybe you will go for more. Usually you don't want to go more than 300 shock per area. And in the operating manual, basically we give you the instruction according to the size of the how to do it. And due to the fact that you move the applicator along the skin all the time, so you calculate in advance the number of shock and do it by moving all the time. So the 4,000, it's not a clear number, because if you, for example, want to treat all the belly and both sides of the hand and something like that, it's a big area. Some people even come to 10,000 shots and for a treatment. This is also common that we will see from time to time. Any other question?
That's it right now, I think. From there, no hands up. No, I think we're good.
Okay, so we'll go to the ED, erectile dysfunction. Now we're moving from a radial wave to a shockwave device. We're going for a different indication, totally different indication, when we're talking about the erectile dysfunction, or what we call the ED. When we present the first time the ED, it was debate if it's really a breakthrough in this technology or not. And everybody agree that if until now, when we use pills or anything else, we don't cure the disease. Here, what we see and what we are doing, and we'll show you later, actually we create a new blood vessel. So in some level, we are curing the disease, or we increase the vitality of the tissue to be like you are much more younger than when you are being before. And that's a very important aspect when we look. Obviously, when we're looking on new technology, we want to see how much it was public and which information existing about it, because this is the only way to see if it's real work or not. And we're happy to say that we have a lot of study in this aspect, but it's important understand which patient we want to treat. And what we want to treat is a patient that they are mainly on vascular base, and sometime also after radical prostatectomy, they could be also a good candidate, but definitely not people that they have a problem with hormones or spinal injury or depression and any other treatment that's create impotence that it's not related. If you want to see what kind of protocol we will choose, obviously we need to analyze the patient if they are mild, moderate, or severe, and each one have their own protocol, and we have what is the expectation for success that we want. So usually we use the IF domain as criteria to put the patient in the right way. If they are normal, definitely no need of treatment. Even so, sometime, and we'll go later, it's looking. But if they are mild to moderate, then a 6 treatment will do the work, and you have a 75% chance to succeed in this aspect. But if you have a moderate ED, then still 6 treatment will do for you a good work. You will have 63% success, and then you need to think what you're doing. And if you have severe, mean IF below 10, it's a good question what you want to do and what is the protocol. And we're talking about 12 treatment, even sometime 24, and to get 77% of improvement. And just to know, those kind of patients that are severe usually will not be satisfied with drug. It doesn't give enough. They need to get at least improve of 9 point, and none of the drug do it. And that's why sometimes they go to combined therapy, shockwave, and drug therapy. What is the treatment protocol? The treatment protocol is doing 3 location on the shaft and 2 in the cora, total 1,500, and a session, a shock per session, and you do it for 6 sessions. The time for the treatment is approximately 15 minutes. Outpatient, of course, the patient doesn't feel anything. The most uncomfortable part during the treatment is to feeling the ultrasound gel and somebody hold your penis. And obviously we start with 6 treatment to the result after months, or to decide if the patient satisfactory, you don't need. If you have response, then it's advisable to think to do another 6, and it doesn't have any response. That's depend on the patient to decide, because you will need much more treatment. A clinical result is very important to know what we should expect, and here we present some result. And what is important when you go to this kind of treatment, you don't want to get a 1 month, 2 months efficacy. You want to get something that will be for you at least for 1 year, and that's why all those study was been for 1 year a follow-up. And if you see it from here, we see that the improvement with SMILE, it's up to 75% of the people will be succeed after 1 year post last treatment. But we see the level of succeed after 6 treatment, 3 weeks after 6 treatment. But obviously we know that's the best result is between 3 to 6 months after the last treatment. So definitely it's good direction. But we'll see that we have a very good result, and that's something that's very important to look for it. But also we try to see what will be our success when we're looking for long-term. And we done a follow-up on 156 patients up to 2 years. And we find that we get up to 53% of the people will still be satisfied. It means that we know that this is repeatable treatment. If you are diabetic person, then most probably you will need to do it 1 in a year. If you are not very old and a normal person, maybe in 2, 3, even 4 years. And if you are very old, most probably any 2 years. So that's basically when you have the expectation what you need to look and to do it. Obviously, when you want to evaluate devices or to use, because it's not like aspirin, doesn't matter who you use it, it's very important to understand the dose and the protocol and all those things. You need to choose a device that's validated by data. And the way to look for it is not what we as a manufacturer say. You need to go what is the scientific world say. And up to date, there is 3 serious meta-analyses by very serious people. One of them is Professor Arthur Burnett from Johns Hopkins University. And when you go deep to those 3 meta-analyze, you see that each one evaluates start between 100 to 300 studies, and in the end they come with less than 10 studies that they are serious, that they are valid, that they have a clinical significance. And usually for them you will see that Medispec more than 70%, or sometime, for example, from Ramasamy, he choose seven studies, and from them 6 was being Medispec, and he decided to take out from, he analyzed them and saw it's effective, but he decided to go to the high quality of studies, and then he was left with only 5 studies, and all those studies was being Medispec studies. So that's very important when you go to look and to see how you evaluate your product. So thank you for this, and we're looking for excellency, and I'm open now to any question.
Thank you very much. Just waiting. Oh, in Brazil, there are doctors using radial shock waves for erectile dysfunction. There is no study that this is effective, correct?
Yes. There is no double-blind study that shows it. There is a few case report. I call it case report because if somebody publish 4 patients, it's considered case report, and it's not valid. It's not with any method to compare it. It's not double-blind, so that's definitely. And when you use a radial wave for ED, you take a risk because radial wave very depend on the operating capability. And part of it, the effect of the radial wave that's getting inside to the body is depend on the pressure that you put on the applicator. So this is something that you can't control it, and you can't get a uniform treatment with the uniform protocol. Another thing that's very important is to treat the cura, the blood vessel that's feed the penis for the erectile, and this you need to go via the perineum, and you need to go quite deep, and this is above the capability of this technology. So radial wave have 2 very strong limitations, with the fact that some people, some rumors start to say that the side effect could be dramatically by bruising to the penile, as well as maybe increase the number of Peyronie, but this is not yet valid. So even we produce both devices, and I don't recommend to use radial wave for erectile dysfunction, and even if it's less expensive, but definitely it's not the valid technology to do something like that.
Just from one of my own questions, how are we treating, or do we have any studies kind of in the works or anything that has been concluded on Peyronie's disease treatment?
Peyronie disease treatment, it's very interesting because nobody know about the Peyronie, enough information.
Same type of thing, but I would say.
Sorry, I muted the line.
Yeah. When we're talking about Peyronie disease, we need to look about 3 aspects of Peyronie disease. First of all, if they have ED problem, definitely that's a ED device, it's a good ED1000, it's a good device. Secondly, we need to look about acute and when it's stable. Because when you are in the acute phase, one of the effects of shockwave is to reduce fibrosis and to stop any kind of inflammation. And obviously, if we do it in the early stage, one of the best effects that we can get from the shockwave is stop the process of the Peyronie. And that's very important. And for this phase is very good. But unfortunately, most of the patient doesn't come in this stage. They come in later stage, so it's a little bit too late. Definitely what is clear that shockwave therapy reduces pain in Peyronie. When we're talking about improve the curvature, we don't need to expect a lot of improvement between 10 to 15 degrees. So definitely I think shockwave need to be considered as part of the Peyronie disease, but we need to know the limitation and how to use it and how to address the expectation of the patient from what you do. Because if somebody comes with, let's say, Peyronie with 90 degrees, don't expect it to go back to 45. That will not be the solution in this case, because even if it will come from the 90, it will go down to 75. It's still not sufficient for the requirement of the patient. But if he come, for example, with 40 or 30 degrees, and he will get a 10-15% improvement, that's for him a big improvement, and he could to skip all the other dramatic option in the process. So each direction in this way, it's something that's need to take in consideration.
Agreed. So a couple of questions here. So I understand that Gainswave, which is also Radial, is gaining a little bit of popularity in the US, and based on the cost, may penetrate to others. Has this had an impact on the ED1000 market?
I don't think it will make any influence on the ED market. We only start the market in USA only in the beginning of this year, and unfortunately the corona influenced us. But if we will talk in 1 year from now, you will see that more gangways will go by the ED, or they will be out of the market, because definitely it will be some complaints against them that's not give the right result. Or give it with other therapy in this aspect, and then they could do it. But I don't see it as something that's need to be and need to stay. Even so, we produce the same technology, but I don't think it's the right technology for this kind of application.
Okay.
Any other question?
No, we've had a nice amount of questions here so far. Just waiting to see if anyone raises their hand or had any questions that they were typing in. But I think that is everyone. We'll give it a couple of seconds here. But again, thank you very much, Avner. This was phenomenal.
Hello?
I think someone has opened their line. Yes, hi.
Hi, sorry, when Igor had asked the question about the radial wave in Brazil, something he explained about the way it may be ineffective on the perineum and all that, I didn't quite catch that. So if you could please repeat, I didn't quite catch it.
Okay.
I was just talking about the ED treatments, and I think the only ones which go to the perineum are the cases of the radical prostatectomy. So I'm also sure, but I didn't quite catch it. I just like to have it repeated so I can understand.
Okay.
Sure.
When we're talking about erectile dysfunction, and I put this picture here that you will be to see, we have the penis that's obviously if it can go from both sides. The radial wave could penetrate. We have a question of uniformity of the treatment. But when we go to the core, and we need to remember from where the blood getting inside to the penis, they go from the core and behind the core. And part of the reason that we don't have a good erection because we don't have a good blood flow in this area. So obviously we need to treat the core. With the ED, due to the fact that we have a very big penetration, that can go from the abdominal to go from this area and to cover the core and cover all the area behind the core and to improve the blood flow from this to the penis. That's something that you can't do with radial wave. That's the depth of penetration and the uniformity of the shockwave going down dramatically. So obviously, to give a good treatment to the kura and to the source of blood to the penis for the erection, it's very difficult to do it with radial wave. You need to do it from the perineum, but this is also something that's you don't come deep enough to be able to do it in the right way, and that's something that's give the limitation. Definitely, if you mention the aspect of after a TURP, most of the damage is in this area, and definitely you want to treat this area, including the nerve. Then in this case, radial wave is definitely not the right device to do it. It even could create more damage. Is it address your question and it's more clear?
Yes, thank you.
My pleasure.
In addition, we also had a question jumping back over to the Slimspec. Does it help to heat or cool the tissue prior to treatment?
No, it's only mechanical effect. The only thing that's maybe it could contribute a little bit because it's increased the blood flow in the area, and whenever you increase blood flow, you increase the cooling effect, but nothing more than that.
Okay. Excellent. I think that's everyone's questions. One last call out for any questions, everyone. I think that we're good. Okay, well, thank you so much, Mr. Spector.
And thank you for opportunity and for all of you that participate in this web.
If there's anything else that anyone had any questions about from Canada, please look us up on www.salientmed.com or reach out to sales@salientmed.com. From around the world, I'm sure there are other various opportunities as well to get in contact with Medispec and medispec.com for any additional questions you may have. I'd like to thank everyone for joining us yesterday and today, and we hope to increase the level of sessions here going forward.
Thank you very much, and thank you for being with us.
Thanks, everyone.
Bye.
Thank you too. Bye.
Thank you. Bye.